This is Dr. Brenden Cochran from Interactive Health Clinic. Hope you're having a fantastic day. What is going on currently for proactive health tips, given the current situation? Well, actually looking like things may be getting better in one way, while things are getting worse in another way. So over the weekend, we did have a report of up to 1,200 deaths. That's some of our highest deaths per day from the COVID-19 virus. Of course, most of these people that we are seeing, most of them, I say, are immune compromised or elderly or in nursing home per se. So what we are learning, and I discussed in some of my previous ones, is the mortality seems lower than we initially thought, which is good. However, that does not mean you should lay down your guard, because there are some people that are perfectly healthy that get wrecked by this, have severe heart issues, kidney issues, neurological issues in their brain, and it's really not worth the risk. I know I don't want to take the risk and try to gamble and see what that might be for me. I'd rather us find out more and more and more information. As we keep finding that out, we find out more children are getting this easier and spread it, as previously we thought that was the case. So there's several things that we're still trying to answer questions for. However, a good thing that has been posted is, remember we talked about a long time ago, these antibodies, they seem to only last about 2 to 3 months once you get this. Well, CDC finally jumped on that and now is saying, well, if you did get COVID-19 and you have no symptoms, but maybe you either you were exposed to somebody who tested positive, then you don't need a quarantine or get tested again. All right, so their assumption is you have enough antibodies, you're not going to get this, you're not going to be contagious to other people unless you have symptoms. We'll see how that works out, because some people we're seeing, they don't mount antibodies at all, while other people do mount antibodies and typically last for about 2 to 3 months. However, this is just focusing on the antibodies. Good news is long-term immunity does appear to be present, as I've talked about, and keep seeing more and more and more studies that your T-cell immunity is what keeps you going. And this could be the long-lasting immunity that we're looking for. And the reason I say this, if you start to look at the curves of what happened in New York, what happened in London, what happened in Italy, what happened in most of Europe, what you'll see is this tremendous spike, and then shortly after the spike, death rates increase because there is that delay in death rates because of hospitalization worsening. And then we see it just drops off to barely anything when it comes to cases, and even death rates drop really, really, really low when we see once it makes its way through the population. So this is good news. If these statistics remain and this picture stays put, meaning we don't have any second wave in the fall, then we could be done with this thing by the end of the year, as some people have hinted at. And we may be done with this before we even have use for that vaccine. This may run its course and just be completely done. That's preliminarily what we're seeing from these areas that have been hit really, really hard. Now, if you did a lockdown really quickly to flatten your curve, what we are seeing is those people that reopen, then it's just coming right back. And where we're noticing that the most right now is currently in Australia, and New Zealand did have some cases that have been popping up that they've been controlling as well. Because remember, at the very beginning, they did an extremely good job in New Zealand of locking down everything and cutting this to 0 cases. And then so did Australia. They got theirs way down. And now we're seeing that it's making a comeback, especially strong in Australia. New Zealand's still too early to tell. And because of their aggressive nature of kind of sniffing it out and stopping it, it's possible they may never get there. But this is one theory that is kicking around. It definitely is a theory that I'm interested in watching because it may be our answers that we're out of the woods with this thing. It's still too early to tell, though. We're still going to see what the fall brings. And that's why, fall is going to bring more colds. It's going to bring influenza. It's going to bring the COVID-19. And the way you're going to protect yourself is to maximize your terrain. Look back at some of my other videos. I know this is a very short one today. It's pretty hot here where I am today, so I'm going to cut it short. If you like this video, please hit the like button, share it. Any other topics you want me to talk about, please let me know. All right, guys, have a great week.